Hello everyone, I'm Nick Payzant, founder and CEO of Cerna Healthcare. I'm here with Dr. Robert Neborsky. He is a neuropsychiatrist. He's here to give us some advice and tips and a little bit insight on Alzheimer's and dementia. Dr. Neborsky, thank you for joining us. First of all, what is a neuropsychiatrist?
Yeah, my pleasure, Nick. Neuropsychiatrist is someone who's trained in the underlying neurological and pharmacological basis of mental illness and organic mental disease, and is comfortable with the prescription of medications and other treatments to reverse those conditions.
Great. So what do you think, especially over the holidays, you see mom or dad or a loved one, what do you think is a behavior or something that might trigger you as to you have to take action or start doing some digging on mom or dad's cognitive health?
Yeah. Well, the hallmark, as we know, of Alzheimer's disease and other dementias is memory loss. And if we start seeing mom and dad not being able to do their usual activities of self-care, paying bills, turning off lights, turning off the stove, other activities like that, these are particularly common early warning signs.
Okay. And what action should we take? Should we go see the general practitioner? Should we go to a neurologist?
Absolutely. That's obviously the decision of the family member, whether you wish to go to a generalist or a specialist. But family practice doctors, primary care doctors, are completely well versed in the diagnosis of dementia and the differential diagnosis.
Sure. Now, I notice a lot of families, some of us are kind of weird about medications, especially when it involves our parents. But should we be open to medications? And are there medications that can make a difference?
Well, first of all, the importance is accurate diagnosis. So again, in seeing the family practitioner, a full metabolic workup has to be conducted along with a neurological examination, and if indicated, a brain scan to rule out underlying pathology before considering medications. The one exception to that rule is if the diagnosis of depression is made. Depression frequently presents with cognitive impairment, and antidepressants, particularly a newer one by the name of vortioxetine or Trintellix, reverses the cognitive impairment in depression. And it's perfectly legitimate to do a clinical trial with that medication.
That is a really important advice because oftentimes our seniors can get isolated and they become depressed. And it's very interesting that depression can lead to cognitive decline. So one of the actions I think we can take is to intervene and help mom or dad from being depressed. So great to know.
Absolutely.
Therapies. Are there any good therapies, whether they're homeopathic or clinical? What do you see kind of on the horizon, or things that you noticed have worked well?
Well, there are no current therapies that prevent Alzheimer's disease, other than the general health activities that we emphasize, which is proper diet, control of blood levels of sugar, and exercise. Exercise are enormous. In men, I strongly recommend checking their testosterone levels and doing whatever is required to maintain normal levels of testosterone to prevent onset of dementia. Those are general health activities.
Sure.
As far as nutrients and supplements are concerned, I'm very impressed with the research of Dr. Rudy Tanzi and Dr. Alan Snow from the University of Wisconsin. Dr. Tanzi's from Harvard, and they've investigated the use of oolong tea, O-O-L-O-N-G.
O-O-L-O-N-G, oolong tea.
And cat's claw.
And cat's claw.
And they've actually made a preparation that they call Percepta, and Percepta is easily available online. You can buy it.
And the cat's claw and the tea, those are available in, say, Trader Joe's or Amazon, something like that?
I'm afraid that you probably wouldn't take it in adequate doses. They've concentrated the dose of the active ingredients. And what's really unique about this preparation is there is evidence to suggest that it delays the accumulation of plaque, which is the primary agent in Alzheimer's disease, offending pathological agent, and tau. Tau is the neuropeptide that destroys and kills nerve cells.
Got it. Now, for those of us that aren't doctors, are not clinicians, so the amyloid plaque and the tau are two components of Alzheimer's that slows and destroys cognition. Is that correct?
That's absolutely correct. And the thought is that the accumulation of plaque, which is a protein which we normally manufacture in our body, becomes accelerated, and we're not degrading plaque in our bodies, in our brains, to the degree that we should be. And therefore it's building up and interfering with synaptic transmission. Synapses are what we develop to retain information, and that the network gets damaged. The tau is the neurotransmitter, or the neuropeptide, that kills nerve cells. And in brain injury, traumatic brain injury, that's when we see the release of tau. So both of those two compounds are at play in creating Alzheimer's disease.
Oh, I see. So the medications that you'll often see prescribed, Namenda, are those involved with the tau and the plaque, or are they involved in normal brain function and some type of catalyst?
No, those are approaching the problem from a different point of view. 80% of our neurons in our brain are chemically mediated by a chemical called acetylcholine. And these are the neurons that begin to die off in Alzheimer's disease or become sparse. And the drugs that you mentioned, Namenda, and the other one is Aricept, which is even more commonly used than Namenda, enhance the levels of acetylcholine that have been diminished by the progression of Alzheimer's disease. And you can recover 25-30% of memory loss using Aricept and Aricept plus Namenda.
I see.
So they're really very useful medications to maintain functioning. It doesn't cure the underlying disease process, however, unfortunately.
I see. Any other breakthroughs on the horizon that you think could be interesting or families should know about out there that maybe will give them hope?
Well, recently, the FDA approved Aduhelm.
Aduhelm.
Yeah, Aduhelm is a infusion in your veins of an agent that cleanses the brain of plaque. It's very successful in removing plaque. It's controversial, however, because a large number of patients who are exposed to this treatment get edema and inflammation of the brain as a side effect. Although it doesn't seem to do very much harm, but the edema is there for a while until it clears up. Then the other aspect of it is cognition didn't seem to improve in those studies, despite the fact that the plaque was removed. So that's still a work in progress.
I see.
And there are subsequent studies in going on to evaluate whether those patients who have the plaque removed eventually restore their brain function. We'll see over time.
Sure.
There are other compounds that are related to this one infusion agent that are promising, and they're in stage 3 clinical trials as we speak. So the future, I would hope, is bright.
Oh, good. That's good to know.
Yes.
So there are several drugs coming down the pipe that we think show some promise. There are some things we can do organically, as you mentioned, tea, cat's claw, cognitive activity, I think.
Oolong tea.
Oolong tea, yes, oolong tea.
And cat's claw tea.
And cat's claw. And as they always say, that cognitive activity, getting out and using the old noggin, seems
Yes.
to be a big help.
Yes, once you have the onset of Alzheimer's disease, again, it's really important that there be a plan of stimulation and encouragement. The old phrase is, if you don't use it, you lose it. So we want to encourage use and attempts to lay down new memory formation in a supportive and caring environment.
Sure. Well, Dr. Neborsky, this has been great information. We really appreciate your time.
It's been a pleasure, and everyone stay well, and let's hope that we get that cure to this dread disease.
Yeah. Thanks for joining us.